Good afternoon, everyone. Thank you for joining us for our swing bed webinar. Today, we're going to be talking about patient family advisory councils, setting them up, best practices. Lindsay will be our presenter. If you have any questions throughout, you guys can unmute yourselves, or if you want to put something in the chat, I'll be manning the chat. We are recording this webinar with the goal of having it uploaded to our YouTube page as quickly as possible. We do have there is a subscribe option on there. So I understand if you do subscribe, you get notified as soon as we do add recordings on there. And that's generally where we house almost all of our webinars. So with that said, I'll turn it over to Lindsay, and y'all let me know if you have any questions or need help with anything.
All right. Thanks, Laura. So I think I said at the end of our last webinar that I would love for some folks to participate and share some stories and experiences, whether you have them or, whether you've started a patient family advisory council, whether you wanted to, and let's share some kind of learnings among the group. So love your participation. All right. So today we're going to go over just, for some, maybe you have not heard of a patient family advisory council. And so there'll be an introduction on kind of what it is, what the purpose is, what the benefit is, some key steps for implementation, and some examples of active patient family advisory councils out there, and some really great resources. I don't know if any of gone out and kind of perused the internet related to patient family advisory councils, or PFACs. I'll use PFACs as short. It's kind of a weird acronym, but there's a slew of resources out there, like examples of policies and procedures. No one wants to write a policy and a procedure. So if somebody has already created something, you could, download it and make it something of your own. So let's get started. So really, what is a PFAT? It's really a council that brings together current and former patients. It could be family members or caregivers, and they come together to really improve quality and patient safety of a healthcare organization. And I use healthcare organization because there are, PFACs that are within clinics or medical groups, or in hospitals or large academics. So really, healthcare organization is really all encompassing. Other PFACs can be used at, a manufacturing company or in the retail space, any type of industry. Amazon, I wonder if they have some type of customer advisory council. I'm sure that they do, but it's very similar. But really, the goal is really the purpose to identify needs of patients and families, rather than going off the assumptions of this is what our patient wants, this is what our patients need, this is what family needs by healthcare organization staff or clinicians or administration. We really want to better understand who our customer is and what they need. Members of a PFAC really can offer insight about an organization's areas for improvement and strengths. So what do they do really well? Where can they improve in terms of the patient experience? Feedback on practices and policies that the family finds really meaningful, or a patient finds really meaningful. Maybe there is a policy within the hospital around visitation, and I'll share, I think I have a story, or maybe I don't, but a visitation around in the ICU, for instance, that there was one hospital that their visitation was only for 15 minutes per patient in the ICU for family members every 2 hours. And one family member story is that they, lost their son in the ICU because of the strict visitation policies. So maybe there's an opportunity to revisit those policies and make them more patient family centered. I'm sure you've heard that buzz phrase quite a bit. But also, council members are able to provide, timely feedback of their care experience compared to the satisfaction surveys or our HCAP surveys that we send out. We don't receive results or feedback from them from months after discharge. This venue can provide, a more timely sense of, what the care experience was like for a patient or a family. Similar to doing patient rounds in the hospital. Again, that is a, best practice way to get that, patient feedback, patient satisfaction, care experience in real time. A PFAC is not a support group. It's not a committee where you can come and complain about everything that the hospital did wrong, or it's not a staff meeting, or it's not a opportunity to pull up a PowerPoint presentation and do a whole bunch of presentations for a captive audience. So some areas that a patient family advisory council is not. Some of the benefits of a PFAP. So, working with advisors and when we think of advisors, we're thinking of both patient and family, could be any type of caregiver. Those would be included in those advisors, but really the benefits come with around better health outcomes for our patients, reduced errors and adverse events, increased patient loyalty, reduced risk of malpractice, increased employee satisfaction, and then also improve financial performance. And, I'm sure that you've all heard that, our payment, more of our payment system is moving towards value. And we're going to be getting paid more for, our quality scores and our patient satisfaction scores and the value that's created within our health system. And so really this is, a vehicle to really truly become a patient family centered healthcare organization, and to be able to improve on how we create more value for our customers within our organization. Then that trickle down effect will hopefully translate to that payment model that awards us for creating that high value. If that makes sense there. Okay, so this is where I'm going to experiment. So I apologize if I fumble a little bit, but I'm going to do this short video. So if you have audio, if you're able to listen in, let's see, we're going to have to do like a new share. Let's do this. It's only a 3-minute video. And this is a 3-minute video on a hospital in Maine. So this is where I live. This hospital is a rural hospital, and they were going to be building a new facility. And so this is just kind of a glimpse into their patient family advisory council and some of the work that was being done with this committee. And so hopefully I can share that. Laura, if you're looking, can you just let me know if this is working?
It's good. Yep.
Thanks.
So I'm going to move to put a motion on the table for the nomination of a chair.
I would like to nominate George Ferguson as our chair.
So
Still got a chance.
all those in favor of George as chair of the Patient Family Advisory Council, yes, say aye. Okay, great. So congratulations.
I'd like to welcome the new members. Lorraine McCabe,
Any council member that's new is we actually want to make sure that we have, we do a dedication. And the dedication is. My worry worm? No more worry. For you to think of somebody that means a lot to you or who has been a patient or a family member, and that as we do this work, they're kept in mind. And so we dedicate, so if you could write their name on the stone with this pen, we do this work around improving patient care and the patient experience that they are here.
I don't know how to knock you. If you didn't see the balloons when you came in, normally we give the balloons at the cancer center on the last day of treatment, but I chose to bring them here tonight. It says, you did it. Congratulations. Part of building that cancer center. And, you know, of course, at the time, little did she know she was going to have to use it. And not that I want us all to think about that strongly, but, you know, there's a good chance that we will be in that hospital bed or in that OR or whatever, just like Jean, you know. So we do need to put ourselves in that bed, that chair, whatever. We need to put our loved ones in there and think about that. This is such important work.
Part of what we wanted to do in a few moments is to look at some of these mock-up rooms or prototype rooms there, because Brad moved this.
I am one of the architects for the project, but we have a number of players. What I guess we'd like to do is sort of get an understanding of the process here for the inpatient room. This is what we call mock-up, where we're starting slowly building up all the portions of the room.
And as I see right now, where would they eat? If that could be a little bit bigger, they
That's
could
a good
actually
point.
sit there and.
Yeah, it's a great idea. Modify the shelf and give it a place to park, but it's still out in the open. The other option here is something that comes off the wall.
Access patients, and sometimes we are not necessarily, the patient may be too ill to talk. It'd be nice to have, it would give more space for the patient too to have.
Height and exactly where they want them. You can move them 300 times here. And, you know, whether you have the glass door.
Caregivers would keep saying, but not too private because we got to see you.
So those are some lessons. Making sure we keep
Okay. All right. Uh-oh. All right. Are we back on the presentation?
Yes.
Okay, perfect. Thank you. All right. So, you know, I really wanted to kind of give you a little bit of a visual of kind of the one part that stood out to me, you know, when maybe was talking about the former patient building their cancer center and that cancer. Numbers about, you know, what a patient family advisory council is, or whether you're talking to your community about, you know, doing that is, you know, at some point in our lives, we're going to have to come in contact with the system, with the hospital, local hospital. But if mental this, if you're struggling with your patient satisfaction scores, you just don't have the answers. You've tried everything to your ability. Maybe that's your sense of urgency, is we need to dig a little deeper. We need to, you know, create a patient family advisory council to be able to help solve the issue. There are some resources and tools out there that the Institute kind of like readiness for really, you know, engaging your leadership, right, to them about starting this and why. Why is it that we would like to implement and involve them in every kind of aspect of that? Development of that patient family advisory council is going to pay off and really lead to success of your person. So the bridge between organizations' leadership and enables the development of the PFAC infrastructure. that liaison works with hospital staff members and clinicians, also works with the advisors, so the patients or the families that are on that council. Also recruits and trains and supports those advisors. And some of the key qualities of a staff liaison would be to stand with the hospital when you're needing to get buy-in from clinicians or staff members, is that you have a good relationship among other staff members and members of the hospital, employees of the hospital. So really well connected within the hospital. A clinical background is not required, but it may be helpful, and it may be helpful, in the sense of, answering certain questions that may come up or whatnot. So just something to consider when you're thinking about, who would fill that role of that kind of that point person. And then, as I mentioned before, the support from the healthcare organization is essential, and it's essential to really sustain and make an impact with this Patient Family Advisory Council. So some of the additional work that's really kind of focused and done by the staff liaison is to gather information. So understand what the organization's culture is, what are some of the current policies and decision-making processes are, and be able to share that with leaders and clinicians and staff to get them familiar with kind of what's going on in the organization, and whether or not they would consider participating in a Patient Family Advisory Council. That's going to probably be, I think, the biggest barrier and the biggest hurdle is to identify staff and clinicians and, a champion leader of the organization within the organization that wants to be a part of the Patient Family Advisory Council. So these couple bullets, are kind of ways that we can kind of think about who we would consider to be part of that team. So are there, some leaders that really stand out in the organization? Who is making the decisions in some aspects of the organization? Do talk to the clinicians and the staff? Do they have concerns about participating in a Patient Family Advisory Council? Maybe they've had some really bad experiences, or maybe they've received some really bad feedback from a patient or a family member, and they just don't want to participate. Getting that understanding, getting that insight certainly is helpful when trying to establish who will be on this council. And then, does the organization have any experience with obtaining patient and family perspectives? So do you have, not just from your patient satisfaction surveys, but do you have, a venue for patients to leave feedback, or to celebrate a nurse that, are there other ways within your organization that patients can and families can participate in some type of feedback or sharing perspectives or stories? So what kind of is already out there? And again, this works with building that support with your leaders, clinicians, and staff within your hospital through regular communication, and to help them understand the process and the value of a patient-centered Patient Family Advisory Council. Along with looking internally, there are certainly some challenges that come up when you're looking to start implementing a Patient Family Advisory Council, and one of them may be around resources. developing and implementing a patient family advisory council is an investment. There's a lot of planning that comes along with it. There's the whole, recruiting, whether it's internal staff members, and then external patients, families, caregivers, it's a lot. And it's not an easy, well, we'll just, start one tomorrow. There's certainly some investments that go into it. There's administrative barriers. So, leadership may, or the administrative team may say, well, what is the cost? They're just thinking, what is the cost associated with the development of a patient family advisory council versus the long-term value. And so, having to explain that, educate them, and get their buy-in, for sure is essential there. And then, planning and sequencing implementation activities. So what is the long-term vision versus the smaller action steps when we start to think about, what is going to be done in terms of the activities at the council level. Clinician and organization staff attitudes. So this is certainly a new territory for some. If you think about a physician that's been in practice for a long time, they've been trained a certain way to practice medicine. And this may be a whole new way of interacting with patients and families that they have not been exposed to or been trained to do. So it's certainly, there's definitely some, some attitudes that are a little bit different, and that's okay. Again, it's the responsibilities of the folks that are going to be leading these patient family advisory councils is to provide that education. If this, certain clinician was somebody that you would consider having on your council. And then patient and family attitudes. Some members as advisors may think that, I'm part of this committee. Am I really going to make any changes at this, hospital? To some, it's very intimidating. And again, can find working this closely in this type of council can be intimidating for patients and families if they're working closely with, clinicians or staff. And that so recognizing some of those different attitudes and some of the challenges when we are developing that, some of those solutions and barriers to those challenges, certainly having that dedicated staff liaison, and then, having the advisors, which are your patients and your families, carefully screened and undergo training and going through, confidentiality, HIPAA training, making sure that we screen for readiness, whether that's with the organization, whether that's with leadership, whether that's with the advisors. And then also as a staff liaison, to be a resource for clinicians and staff, to be able to educate and answer questions to those members. So once we have identified the staff liaison and we start to talk internally about developing a patient family advisory council, we need to think about kind of what the structure is going to be. And so, things like what the mission statement is. It's really around, guiding and focusing the work of the advisory council. If some, there's different degrees of patient family advisory councils. Some are more of the focus groups, and they may not consider, establishing bylaws, which that's okay. But I think if you're going to implement a patient family advisory council, that's kind of the traditional patient family advisory council, there are bylaws that typically are developed. And so, where you outline kind of how the council functions and outlining member responsibilities. Some functional items that may be included in your bylaws, maybe, what's the eligibility for membership, what are term expectations, meeting schedule, and then the roles and responsibilities. Some additional items may be around training and orientation, attendance expectation, reimbursement expenses, and then the annual review process. So similar, if I have quality folks on the line, maybe it's similar to, your QAPI plan, or it's similar to your board governance bylaws. So using those as examples. Your council will have goals and objectives that will get established. And then there's also budget considerations. So depending on, if there will be expense reimbursement for any of the members on the Patient Family Advisory Council for parking, transportation, supplies, whether or not the members get stipends, or some have received gift cards for their participation. Do you serve dinner at the meetings, or do you just provide snacks? Understanding what, or planning for what maybe some expenses. And then, the real important part here is what are going to be our measures of success. And we think about those in structural, process, and outcome measures. So structural are not, more like what is the number of members that we have? What are the various committees that we have? What events did we attend as a council? What did our advisors participate in for activities of the organization? Things like that. Process measures may be whether or not they provided feedback on, policies and procedures. What was their impact on, various accomplishments? What was, was there, what's their approach to storytelling, or something like that. Outcome measures is, really specific to, something, patient safety driven, or whether it's hospital acquired infections. What did they do in terms of our policies and procedures around hand washing? Was there something that we can measure from an outcomes perspective? Maybe they assisted in developing a discharge folder. And so we can see that our hospital readmissions have gone down, or our discharge planning HSCOT scores has improved. So things like that are, what are we going to measure in terms of our success? And then the second piece of this is now focusing on the patient and family advisors. And so, as I mentioned before, the Patient Family Advisory Council can really function in a variety of ways, whether it's like short-term projects. So maybe you are thinking about building a new hospital or adding a new program, or I worked with a hospital in rural New Hampshire, Vermont. Oh gosh. I think it was Vermont, now that I'm thinking about this. And they wanted to develop a geriatric center of excellence. And so this new program, we pulled together more of a focus group of hospital staff and community members and patients and families and other industry, groups to really help focus on this development of a center of excellence. But then again, the range can be a lot more expansive. So, you kind of want to think about what type of activities, initiatives that you would want the Patient Family Advisory Council to at least kind of start to focus on. but more specifically to the advisors. Typically what we've seen is 12 for a small community hospital tends to be a good number for members, for total members, up to 25. You don't want to get, too big, and you don't want to get too small for a variety of reasons. But you want to have a mix of healthcare organization staff, clinicians, patients, and families. Some of the roles and responsibilities that the patient and family advisors can take on is around a chair or a co-chair. So that position really works closely with the staff liaison and carries out that vision of the council. The members, the patient and family advisors, need to be, have their role is to participate in meetings. They share perspectives, ideas, and feedback. They could have roles that are designated to them, like a meeting facilitator, a timekeeper, a secretary. And then the healthcare organization staff, really attend meetings and implement council activities. The time commitment for a patient and family advisor is, typically what we like to see is meeting one time a month. Throughout the year, it's around, 9 to 10 months. We've had some organizations that don't meet during December or don't meet like 1 month in the summertime, just because getting everybody in a meeting during those times tends to be, with vacations and whatnot and other priorities, tends to not work as well. Meetings are generally 1.5 to 2 hours long, and term commitments typically are between 1 to 2 years. So for those advisors. And all this would be included in your bylaws. So we've decided, who we're going to, kind of developed our structure. And then we want to start to think about recruiting and selecting and training those family advisors, patient and family advisors. So we go through a kind of a set of series of steps. So first, determining what our advisor qualifications are going to be, and to be able to recruit from those determined qualifications. So whether that be, they've received care at our organization within the last 3 to 5 years, whether that's care of a family member or of a patient, they have a diverse healthcare experience. So they just didn't come, maybe they have used the healthcare system a couple times, or maybe their family member has been had surgery here and is established patient in the clinic and, utilizes lab services, has that, diverse healthcare experience. And is a representative of the community served. So I think this is certainly an important aspect here, is that we want to make sure that we recognize and kind of hear the voices of our patient population. So making sure that we are recruiting from our patient population. I think there was a story around the establishment of a patient family advisory council. The hospital it was located near a tribal reservation, and they did not consider having anybody from the reservation participate on the council. And it was brought to their attention that, a large portion of your patient population is tribal members. And why wouldn't, you recruit a member of the reservation to this council, and hear their perspectives on how they perceive the healthcare system and what kind of care experience have they had within your hospital. So again, making sure that we identify our patient population. Where to find advisors. So having our staff members or our clinicians relay the message that maybe these patients have demonstrated an interest in their care or care of a family member. They have potentially provided constructive feedback in the past. So whether that be through your patient surveys and your feedback, we want to that could be a potential advisor or recruitment of an advisor. And then utilizing recruitment brochures in your website. So putting out an application on a website that, hey, we're looking for, these qualifications. Would you be interested in participating in a patient family advisory council? And then that will, hopefully get you a pool of candidates. And then that would lead to, holding an information session and interviews and applications, and then a advisor orientation. So, the information session is really educating your patient and family members or potential advisors on what the roles and responsibilities and logistics, whether it's like time commitment, of participating in this council. And then your application and your interviews is really, the interviews is, why do you want to become advisor? What experience did you have? Can you share some of your perspectives about your care experience? What are some of your strengths and your skills that you could be bringing to this advisory council? And very importantly is, can you commit? Because we need our members to commit to this council. And then having an advisory orientation. So again, you may already have an established volunteer orientation. So utilizing that, and then have one, geared towards just the expectations of the Patient Family Advisory Council, and more of an information session on the hospital. And so how do we, so as we kind of moving through, so we have staff liaison decided, we've gained support from our current staff members, clinicians, leadership team. We've started to decide on what the structure is of our Patient Family Advisory Council. We are working to recruit and build out our patient and family member advisors. But okay, so now we get all of this. What are we going to do? So one of the key, opportunities is around having all of the advisors always be alert on strategic opportunities. So, whether it's you hear something from, hospital staff that you may, clue in, hey, this might be something, an activity or an initiative, or you want to get input from the Patient Family Advisory Council. Also having, integrating our advisors into the organization so they are able to kind of bring back initiatives to the council. So whether that be part of our annual planning process, making sure that we educate our staff on the benefits of a PFAC, and then, communicate and collaborate. And then this one, double star this one is around sharing best practices among peer organizations, and I've said this before, is sharing what works and what doesn't with each other, I think builds, a stronger, program for you all and bringing that back to your organizations. So definitely sharing those big best practices. And then, advisor accomplishments. So we want to make sure that we share the achievements of the council. And this goes back to measuring our successes, but we also want to be able to publicize our accomplishments, because that in turn will build additional support from leadership, the community, and clinicians, if we're able to share in some of our accomplishments and measure and track some of our activities. Some topics for various patient family advisory councils that they have contributed to, everything from facility design and workflow, policy and program development. A big one tends to be around the patient experience. There's been, I've seen some activities from a PFAT around the patient and family communication. So really taking a look at health literacy and looking at, the information that we put out to our patients and families. Is it easy to understand? There was a story about feedback from a member of a patient family advisory council that, the physicians tend to just, speak to the patients like they're speaking to other physicians. And, until you kind of hear that, you don't think it's like a problem potentially. So, getting that feedback and understanding, okay, well, what's the action plan? What are the steps that we need to do to kind of change this problem? And how can we leverage the council to make that happen? So there's just so much that this venue can really do and help move an organization. So let's just share a few examples. So when you receive this PowerPoint, you'll be able to kind of click and go to some active patient family advisory councils. You can see, the John Hopkins and the Dana-Farber, two huge, academic medical centers, teaching hospitals that have implemented a patient family advisory council. And then, you have a county hospital, and then you also have a rural hospital that's within a larger health system. As I said before, a patient family advisory council can be implemented in any size organization. And you really need to understand what your capacity is in terms of your own resources, not just expenses, but understanding if there's a dedicated staff person that can really lift this off the ground. And I think that's probably also potentially a barrier for some organizations to implement, is around, we don't have a dedicated staff person to make that happen. So I invite you to go and kind of click around to see, how they've organized their patient family advisory councils to the public, how they've laid out what their mission and vision is for the council, how are they actively recruiting. Some of them also share their accomplishments right on their website, which I think is great. Some of the larger health systems actually submit an annual report that actually goes through all of their activities and measures and tracks their success in terms of implementation. So some stories I wanted to share that I found really great is this one from Beaumont Health. Back in 2018, Beaumont Health is in Michigan, and the new state law was changed around opioid prescriptions, and that prescriptions you could not refill or write more than a 7-day supply of opioids. And so the Beaumont Health partnered with their Patient Family Advisory Council to develop a letter to patients that describes the new legislation and includes supportive language and positive messaging. I think that's great. I think, it may seem like, such a small thing to do for potentially a subpopulation for this health system, but it really, leveraging that council to provide insight and feedback on language in a letter, I think is so creative. And then there's the example from Dana-Farber. And just as a side note, we had a former consultant here that at the time this was done, she was the COO of Dana-Farber, and she actually developed their Patient Family Advisory Council. And at the time, their Patient Family Advisory Council was really involved in the building of a new facility. And so this is kind of just her thoughts there, is that the Patient Family Advisory Council actually suggested which architectural firm that Dana-Farber should use for their new cancer center. So, it's certainly this council can really make a huge impact and be kind of at the table to make some decisions, because, at the end of the day, it goes back to, creating a patient and family centered, health system. So I'm going to stop talking and catch my breath for a second. I'd love to hear if anyone on the line has implemented a patient family advisory council. And maybe you can share some of your own accomplishments or what have been challenges. Or if you have not developed one, maybe what are some of the barriers? Is there any resources that you think that you need to actually implement a patient family advisory council? And then do you have topics that you would consider bringing to the council? So whether it's, we're really struggling with our readmissions, or, does something like that come to your mind? So I'll stop. And if anyone wants to share, certainly the chat is open, and feel free to share.
Hi, Lindsay. While people are gathering their thoughts, I did want to ask you a question. I sent this webinar information out to everyone we have a contact info or email for, and we included RHCs. So I did notice there's a couple RHCs on this call as well.
Great.
Some of your examples, do they include like provider-based clinics having a few people at the table as well?
Yeah, absolutely. I think that I said at the beginning of the presentation that I use the word or the phrase, healthcare organizations, because I want to make sure that we're including hospitals and clinics. Worked with a rural clinic in Arkansas that I was very surprised to learn that they had established a patient family advisory council, and it was very well attended. Community members wanted to be involved in really making this clinic. This clinic actually only had, 2 locations, very small. I think, a half FT physician and like 2 nurse practitioners. But they really, valued their input and feedback from their patients and their families to really improve the care experience. And so really cool to see that it doesn't really matter, how large your organization is. I think that you can get that input and create, these councils. Anybody thinking about considering a patient family advisory council, or if you are have not implemented one, what tends to be the biggest barrier for implementation for you all? I definitely have heard that leadership support tends to be a barrier. And then having, a point person to dedicate this to, when we're working in rural, everyone's wearing 1,000 hats. Okay. Well, everyone's quiet today. Normally you all are, this group isn't that quiet. So I'm very surprised. I did want to include some resources here that really, like I said, there's a slew of, whether it's policies and procedures or, readiness assessments, tools out there that can help you, that have already been created, that you don't need to recreate the wheel, in terms of supporting your patient family advisory council. And so here are certainly some tools and resources for you all. This will be included, these little links, and you just need to click on them when you receive the PowerPoint. And I believe a recording will be sent out, right?
Yes.
Oh,
Sorry, I didn't.
no, that's okay. That's okay. Does anyone have any questions? No questions. Wow, you guys are quiet today. That's okay. If you have, certainly, I really love working with your group, because I know that, you got to digest it a little bit, and then a question will pop up, and then you'll email Laura, who'll email me, which is great. I'd love to answer any questions that you may have. So feel free to shoot me an email or call. But I really do think that, worked with a slew of organizations that have really embraced this, patient family advisory council, and have had real successes on it with it. And it's very, it can be a shift in your culture. That's for sure. It hasn't worked for all organizations because of, potentially not a great culture at the organization. So, but it's really great to see when it really works. Okay, well, that's all I have for you. So I think I'm going to give you back 4 minutes of your time today. Appreciate you all hanging in and listening, and I hope you have a great rest of your day.
Well, thank you, Lindsay. And for everyone who's on the call, as you move forward and set these up or decide to set up a council, please keep me in the loop, because this is something I've been interested in for quite a while, largely for the engagement aspect. So yes, please keep me in the loop of what's going on. And yeah, we'll get this uploaded, and I'll send out a link when it is available online, along with Lindsay's slides. So thank you all. Y'all have a great rest of your day.